Hi, I'm going to talk about our Center for Student Wellness, and we are in the process of changing our name from Health and Counseling Services to Center for Student Wellness during the summer of 2022. So bear that in mind as you are going on the Winthrop website, seeking out additional information, as that takes time for things to be updated within the system. So the majority of CSW departments are located in the Crawford Building on Scholars Walk. So we are known by the curved second story porch. In there, you will find health services and counseling services on the second floor. And on the first floor past the elevator, you will find student advocacy and trauma support, as well as the health promotion office. You can access Crawford Building by the staircase to the front porch or in the rear of the building underneath the breezeway. That is an accessible entrance. Please know that because Crawford is a healthcare facility, masks continue to be required at all times. Next door, in Bancroft Annex, which is attached to the back of Owens Hall. So this is directly next door to Crawford Building on Scholars Walk, is where you will find the Office of Accessibility and the Test Center. Students must meet eligibility requirements to access our services. And so those include being registered for the current semester, being compliant with the immunization requirements, and being current on paying tuition and fees. So you have to have paid the semester-based fee. That then makes you eligible to schedule appointments with counseling services and health services. And to do so, you can either just call us on the phone, walk into our office, or schedule on the patient portal. You can find the link to the patient portal on the CSW webpage. We encourage you to get familiar with this portal because you will use that immediately by uploading your immunization records, but that is also how you can schedule counseling, same-day appointments, and either immunizations or triage appointments for health services. If you are in need of scheduling a physical or a gynecological exam, you have to call to schedule that. You may not do that through the patient portal. So this is where you will upload as an incoming student your immunization record and completing the immunization form. And you have full access to everything that you upload in there. So if you're not sure if we received it, log into the portal and you'll be able to see it right there. And if you happen to test positive for COVID-19, then this is also the location where you would complete a QI form and upload your positive test result. If you're an online only student, then you need to call health services at our main line in order to start using the patient portal. Make sure that you are using the Firefox or Safari browsers, and we also have a video on our website explaining how to use the portal. So when you click on that, this brings you to our home page. So you can register by creating a username and a password. It does not have to be the same credentials that you use to log into Wingspan or your email. But it is very, very important that you remember what this information is because only you will know this. We're not going to know this. If you have a family member assisting you with uploading your immunization requirements and they are the one who sets up this account, please make sure that they tell you your username and password because again, you're the one who's going to be using this while you are a student here. So again, the landing page has all of the instructions that you need and also has additional links that takes you back to our website to further explain immunization compliance or for how you can contact us if you have questions or problems with accessing the patient portal. So everybody who is going to be attending at least one in-person class on campus is required to be compliant with our immunizations. There's forms that a form you have to complete. You also need to enter all of your immunization dates and then upload your immunization records into the portal. We also ask for insurance information, and that's just so that if we need to refer you to a provider in the community, we also help with setting up that appointment and need that information. If you are needing to schedule an appointment with health services, again, the portal provides the step-by-step instructions for how to do so. You would just simply select the appointment tab and then click on an HS appointment and then type out what your symptoms are that you're experiencing. It'll show available times, and if nothing is left and you absolutely need to be seen before we close for the day, then just give us a call and explain what's going on, and the front desk staff will have a nurse work with you on getting you in. Likewise, if you are needing to schedule a same-day intake appointment for counseling, you go to the appointment tab, you click on counseling same day, and follow those prompts. It will show you available time slots that are open, and I will strongly recommend that you log on. If you're wanting to initiate counseling that day, because these are first come, first served appointments, the earlier that you log on, the better chances you have of finding something that's going to work with your schedule that particular day. You can access these times as early as 7 a.m. If you are experiencing a mental health crisis and there are no slots left, just call us and the front desk staff will get you connected with the same day triage counselor. When you need to upload documents, you just click on the upload tab, and then this lists all of the types of documents that you can upload, but you would select that in that drop-down menu in that bottom blue box, and then it'll prompt you on how to upload your document. Your health has a significant impact on your ability and readiness, rather, to learn. So obviously, when we don't feel well, that affects our concentration, our attention, our energy level. So that is why we have health services available to students on campus. I've already mentioned the eligibility requirements. I want to emphasize the importance of making sure that you have completed the immunization requirements in full before the first day of classes. When we do not have all of the immunizations that we need from you, or you have not completed everything on the form, then you will receive personalized emails. So these are not generic emails, these are personalized to you and explain what it is that you still need to do, and everything is done through the patient portal. Failure to get this taken care of is going to result in a registration hold, which means you cannot change classes, you can't register for new ones or drop any classes, and you will also incur a non-refundable immunization non-compliance fee. We do not want that money, and we do not want to apply registration holds on your account. We want you to be compliant and provide all of the necessary documents for that process. You will get warnings, like I've said, via email, potentially even phone calls, so it is completely avoidable. If you're having any problems with accessing your records, then again, give us a call. That's especially prevalent if you have military service, and sometimes it's difficult to get those records from the VA. So just give us a call and we'll work with you. But if we haven't heard from you, then you don't respond to our messages, it is going to result in the hold and the non-compliance fee. So because you are paying a semester-based fee, there is no office visit charge to be seen. If you require service such as physical exams, lab work, supplies such as renting crutches, over-the-counter medications, I don't know, digital thermometer, any number of things, those charges would go on your student account as health services. It will never list specifically what the charge is for. So health services treats sudden onset illness or injury. So we are an acute clinic. We do not treat chronic conditions. So if you have any chronic medical conditions, you need to continue working with your provider at home. As I've discussed previously, you can either walk in through the doors and see if there's an available appointment immediately, or you can call us or schedule through the patient portal. Everything that we do in health services is confidential. So if somebody calls wanting to know if we're working with you or wanting to know what a charge is on your student account is for, we cannot confirm or deny that we know who you are, that we've worked with you or provided any services, unless you have signed a specific release of information for that individual. We do sell over-the-counter medications such as acetaminophen, ibuprofen, allergy medications. and those charges would go on your student account. Our prices are the same as what you would find in local pharmacies, of which there are several across the street. We do this as a convenience for you since you're already on campus. If you enroll in the school-sponsored student health insurance plan through Blue Cross and Blue Shield, and you can find out more information about that on our website, Health Services is considered the primary care provider. And if you incur a charge, say for example, for a vaccination or a physical exam, then that cost will be covered in full by the student health insurance plan. It's very important that you know all of your allergies and all of the medications that you are taking, including their names, the dosages when you take them, and so forth. That's information that you'll need to provide to the nurse when you are seen. We very strongly recommend that you get fully vaccinated and become up to date with all relevant boosters for which you're eligible for COVID-19, as well as getting a flu vaccine each season. Winthrop is a residential campus, which means we are considered a congregate environment that has a higher likelihood for infectious diseases such as COVID-19 and the flu to spread easily. So please do what you can to protect yourself. And we also still strongly encourage wearing a highly protective mask like a KN95 for added protection. If you are sick, please make sure that you stay put in your room and you call health services or you schedule a triage appointment in the patient portal. That way you can be guided by a nurse on next steps. You do need to report to health services if you test positive for COVID-19 or if you're notified as being a close contact. That way the nurse can talk to you about next steps, including about, isolation and quarantine. We do offer rapid COVID testing within the clinic for a nominal fee, and that again goes on your student account. Please make sure you're washing your hands really well, being careful about what you're touching and how you're touching your face and so forth. That is key to protection for a number of things. I've already referenced the expectation to report testing positive or being a close contact. In the event that Winthrop decides to require a negative COVID test at the start of the semester, that information will be emailed to you by administration. So pay attention to your Winthrop email account. And then we would also have the instructions available on the Center for Student Wellness website. If you are a residential student and you test positive and therefore need to isolate, or you're a close contact and you do need to quarantine, then you are expected to return home to do that time. Residence Life will require a documented plan from you for what you would do in the event that you do have to quarantine or isolate. And I strongly encourage that you have backup plans for what that plan is that you submit, because we have seen that, students think that what the plan is they've submitted would work out for them, and then something happens and they have to scramble. So save yourself that stress. For any reported illness or quarantine that results in absence from an in-person class, Health Services, with your permission, is going to notify the Dean of Students office, and it's that office that will then provide you an official absence notification that you then send to your faculty. You are still responsible for making up your work, but that is what the faculty looks for in order to have that flexibility with you, working with you on making up work and working with you on their attendance policy. And it's only from the Dean of Students that provides that official absence verification. Health Services is only going to share the dates of your absence regardless of what the health-related issue is. We are not going to share any details of what's happening with your health, and it is your responsibility to notify your family. Coming to college can be stressful, especially if you are transitioning from one institution to the next. And so it's important to recognize when you're struggling and being willing to ask for help. So that is what Counseling Services is here for. We offer same-day intake appointments and just same-day emergency appointments. Those are, again, first come, first serve, and you can schedule those through the patient portal. And again, I encourage you to log on as early as possible in the day. If something comes up during the day and you find yourself needing to speak to a counselor right away, then just give us a call at our main number and explain your need to talk to a counselor right away to our front desk staff. Just like in health services, counseling is completely confidential. You are required to sign a release of information for any individual for us to be able to either confirm or deny that we're working with you in any information. Again, there is no charge to be seen for counseling. We offer the semester-based fee that you're paying covers up to 8 sessions per academic year, but there is no limit on groups, and that information is best found on our website for updated groups that are available each semester. If you are experiencing trauma and you are ready to work on that trauma because it is having a direct impact on how you're doing at school, then we offer specialized trauma support through student advocacy and trauma support. Again, that's located in the first level of Crawford Building. If you are currently taking behavioral health medication and you are unable to continue to see your provider that is prescribing that while you're away at school, then you, after talking with your counselor here, you're wanting to explore starting behavioral health medications. We do have a psychiatric nurse practitioner. That is an additional charge per appointment, and you are required to be actively working with a counselor in counseling services to be eligible to see our Psych NP. You will have a much better transition and adjustment to Winthrop by getting connected, getting involved, explore what are available student organizations and clubs, including rec sports, talking to classmates, getting to know campus, attending various events. That's going to help you feel connected to this institution and like you belong here. It also is going to have a positive impact on your academic performance and help your overall sense of well-being and connectedness. What coping skills you have been accustomed to using may continue to work for you, they may not. So if you find that it's no longer working, then just make sure that what else you try is healthy, such as meditation and exercise, a healthy diet, reaching out for help, building a sense of community with friends and talking to family, or talking to your resident assistant if you live on campus. The residential success coordinator is the professional residence life staff member who lives in the residence hall, but we also have very committed faculty and staff on this campus who really invest themselves in wanting to make sure our students are succeeding. So help is available to you, but it's very important for you to communicate when you need that and a willingness to engage in that. And if you have a disability, especially if you have had accommodations at your previous institution, then it's important to get registered with the Office of Accessibility over the summer, or at least at the very beginning of the semester. So you can initiate that request through their website. So go to Office of Accessibility's webpage and click on the registration tab and just follow those instructions. So this first process is easy to complete through their website by filling out the accommodation request form. And if you already have supporting documentation such as testing information or an IEP 504 plan or copies of accommodations from your previous institution, go ahead and upload that supporting documentation and then schedule your intake appointment. If you don't have supporting documentation yet, then you can download the disability verification form that you need to give to your provider for them to complete. Accommodations or the letters are not retroactive, and they only focus on the current semester in which you are enrolled. So, if you struggle and you wait until weeks into the semester, then, when you finally do get registered, those accommodations are not retroactive. So anything that you may have struggled with academically, OA is not able to assist with. It's only from that point forward after registering. So this is for campus and classroom accommodations. So campus accommodations would be, specific to maybe meal plans or residential setup. So that concludes the basic information. I strongly encourage you to visit the Center for Student Wellness website for additional information. If you still have questions, then please email woohealth@winthrop.edu or call our main number and talk to the front desk with your questions. So welcome to Winthrop. Take care.